Texas Congresswoman Jasmine Crockett's Senate bid for the Democratic nomination has upended two Democratic candidacy. Her campaign sent Colin Allred out of that Senate race and into a House race against incumbent Julie Johnson for Texas's 33rd congressional district. I spoke with Congresswoman Johnson earlier today. Congresswoman, I don't need to tell you, but redistricting has plunged you into a primary you did not expect with Colin Allred. He was on our show December 18th, and he said he would be a strong voice representing Dallas, stand up to Trump, confront the affordability crisis and corruption, but also teach the Democratic Party some lessons so it's not so associated with elites and elitism and disconnected from folks. Will you evaluate those remarks?
Well, what we know is, yes, redistricting certainly put chaos into our political system in Texas and is doing so across the country. And, I'm thrilled to be running for re-election in this district. It has a significant portion of my existing district, part of the legislative seat that I represent, and just a very well connected. But yes, people need affordability. That's the number one issue. I've been up here in Congress fighting for those issues on, the cost of groceries. A cart of groceries that people pay for right now is out of control. It's the highest it's ever been. A cup of coffee, healthcare, energy prices. These are the things that we need to be focusing on, and I'm certainly doing that while I'm here.
Is Colin Allred AWOL on those issues, or was he, in your opinion?
Colin has certainly advocated for those things too. I'm not going to suggest that he hasn't. That's what Democrats do. I think people really like to pit within the family. But I'm certainly here, and I am serving this constituency. I'm working very hard. I've authored a lot of bills. I'm laser focused on the climate that we have. He's been out of Congress for several years now, and I'm in it now and focusing on these issues on a day-to-day basis.
You also been quoted saying a lot of women have had a similar experience where men vacate, women get promoted, the men don't succeed, and then they try to swoop back down and kick the women out of their spot. Is that what you think Colin Allred's trying to do?
It certainly is an implication. Women have faced this, and I think it's a conversation that needs to be had. Right, wrong, or otherwise, there still are glass ceilings for women in this country, and every aspect, not just politics and business and the like. And women advance and then get pushed back down or get looked over or somehow seen that this is a different seat. I have to wonder if a different member of Congress was sitting in this same seat, if he would have made this same decision. I don't know if he would have. And so, I think it's a conversation that women are having. A lot of women have reached out to me in this race, very upset with his decision to challenge me, and with a lot of support. As we've seen this with Emily's List, Elect Democratic Women, many women in the House are endorsing immediately, and I think you're seeing a really robust response to women because women across this country have felt the same thing in their own lives.
He said about you, it's outrageous that in less than a year in Congress, Julie Johnson has traded stocks hundreds of times, calling it gross and saying you've become fantastically wealthier. True or false?
Completely false. It's the thing is that in Congress, what we're supposed to do is ethically disclose our trades, which I have done. I've also signed on to the stock trading ban immediately when I got here, and I've co-lead several things, and I'm in the process of divesting my stocks. It's what I have pledged to do. That's what I have been doing. So it's really disingenuous to imply that I'm doing something nefarious. What I said was members of Congress should not be holding stocks. I had a long career before I came to Congress. I definitely, had an equity portfolio, and I have been in the process of voluntarily divesting of that. So if you look at the trades, it's been sell, sell, sell. I've been selling my portfolio because I do believe that members of Congress should not be holding equities like this. And so I have supported that with legislation that I've signed off on, and I have supported that in my own actions to be able to divest of my own stuff. So to imply that there's a nefarious component to that is very disingenuous, and it's not truthful.
Congressman, this week the House voted narrowly, but it still passed a bill that would criminalize transgender care in America for minors. The Trump administration is promulgating rules that would limit or ban the reimbursement through federal health insurance for the same kind of transgender care for minors. How do you evaluate those moves, and do you expect that to be a point of conversation in your primary with Colin Allred?
Well, I think it's absolutely wrong to criminalize parents' decisions over the control of the health care of their children. I absolutely also think it's morally wrong to criminalize physicians who are trained, who have expertise in the field of medicine, from interfering with the physician-patient relationship. I think whether or not, trans health care, that is a very personal, that is a very private decision that families make, that parents make about their kids, and that with the consultation of doctors and physicians and medical organizations. Every single medical organization and professional association has come out against the criminalization bill that was just passed. I vehemently oppose it. I think it's wrong. I think parents should be in the position to make the decisions for their health care. They're the ones that know their kids best. They're the ones that have the best opportunity to make the evaluations, and that should rest with them, not with politicians who don't know a damn thing about their child or don't know a damn thing about the health care relating to their kid.
You and other members of Congress are getting ready to leave Washington, which means the enhanced Obamacare tax credits will expire on December 31st. There's a discharge petition, which means the House has to confront this issue first week back in January. Size it up for me. What does January look like on this issue?
Well, it's going to be really interesting. The Speaker has consistently refused to bring about a vote on extending the Affordable Care Act tax credits. I signed on to that discharge petition. The American people want their health care. They want affordable health care. I have over 100,000 people in my congressional district that get their health coverage from the ACA. Texas leads the nation in people without access to health insurance. So this is a very personal fight to the people I represent, and also for just what is right. I think it's interesting that 4 Republicans who are in very vulnerable districts have done their polling, and they realize also that their constituents, that the American people want affordable health care, and have signed on to this discharge petition. So we're going to get a vote, and I have a feeling it's going to pass the House by more than 218.
When the president says, as he did today, that the Democratic Party is owned by the insurance companies and he wants to give money directly to individual Americans, how do you evaluate that? That is outrageous. The Democratic Party are here to benefit the people. We're trying to make sure that health insurance coverage is more affordable for them. This is a direct benefit. The tax credit goes to the people. It's on your very tax return. It's your premium that you pay. This is not an insurance giveaway. This is making it where people can go to the doctor and get care when they need it. Congresswoman Julie Johnson, Democrat of Texas, I appreciate the time. Thank you so much.
Thanks for having me. Great to be with you.